After this lecture, you should be able to describe the generalized functions of blood, identify and diagram main type of blood cells, discuss anemia in terms of erythrocyte number and hemoglobin content. You will be able to identify locations and organs where blood is made. You will be able to describe and discuss some features of malaria, yellow fever, and polycythemia vera, among other conditions and diseases. Blood is a connective tissue, which means its living cells are emerging non-living ground, substance or matrix. Its matrix is plasma. The blood which flows through a cut finger seems to be a bright red throughout. When a drop of it is looked at microscope, however, the liquid itself is seen to be almost as clear as water, though it is slightly yellow. Yes, this liquid is called plasma. Floating in it are millions of biconcave discs containing a pigment, hemoglobin, which gives the red color to the blood. The discs are called erythrocytes. They function as containers of hemoglobin molecules, preventing its elimination. There are about 280 million hemoglobin molecules per single erythrocyte. Erythrocyte. Erythro means red, and cyte means cell. So erythrocyte means red blood cell. A few irregular shaped bodies, nucleated and almost transparent, and called leukocytes, also found in the blood. Leukocyte. Leuko means white, cyte means cell. Leukocyte means white blood cell. Leukocytes are, however, far less numerous than erythrocytes. They are cells of the immune systems that help the body fight off infections and foreign materials. They increase in number during diseases. Yes, leukocytes defend the body from infection and disease. Their function is chiefly disease control. The erythrocytes go only where plasma carries them. The leukocytes sometimes leave the blood vessels entirely. They have ability to go through the walls of blood vessels straight to the tissue. The process called diapedesis. The word is Greek and literally means leaping through. On the diagram, you see neutrophil leaping through the cell wall. This happens as part of inflammation. Inflammation is a localized physical condition in which part of the body becomes reddened, swollen, hot, and often painful, especially as a reaction to injury or infection. Let's not forget other part of the blood, the thrombocytes. Thrombocytes or thrombocyte means platelet. Thrombocyte. Thrombo means clot, and cyte means cell. Platelets play a major role in blood clotting. Now let's make sure that we label everything correctly on the smear of the blood under the microscope, so we can take a closer look at the components of blood. Blood consists of plasma and the three classes of formed elements: erythrocytes, leukocytes, and thrombocytes. We will start with plasma, the liquid part of the blood. As we established on the beginning, the liquid part of the blood is not red. It is yellowish or straw red color. If we to spin a test tube of blood in the laboratory centrifuge, we see the plasma make up about 55% of blood. And plasma itself is 90% of water. It is perfect media for transport. It transports erythrocytes, leukocytes, thrombocytes, and substances that come from food we eat. So what are those substances? 7% of plasma are proteins. The rest are sugars, fatty acids, vitamins, minerals, and electrolytes. Some of the proteins involved in defense. Proteins called antibodies are involved in fighting infections. Antibodies are proteins that your immune system makes to help fight infections and protect you from getting sick in the future. Another protein called fibrinogen helps to clot blood. The clotting of blood prevents bleeding to death. Fibrinogen. Fibra means fiber, and gen means to produce. An enzyme called thrombin is the active agent in changing fibrinogen to insoluble fibrin of a clot. Thrombocytes are the ones that activate thrombin to do its work. The most important protein in the blood plasma is albumin. Albumins pull water from the interstitial fluid that is from outside tissue of the blood capillaries. Albumin maintains the osmotic pressure in the blood. There are many different enzymes in the blood. Enzymes are biological catalysts, are substances that speed up biochemical reactions in the body. They are also hormones, are lipids that regulate body functions. Electrolytes like sodium, potassium, bicarbonate, chloride, and calcium help maintain blood pH. As you perhaps remember from previous lectures, electrolytes are substances that have a positive or negative charge when dissolved in water. I almost forgot to mention globulins, that are a diverse group of proteins in plasma that transport various substances. I discussed them a couple of times in the previous lectures. When this protein attached to lipid fat molecules, it creates a complex called lipoprotein. Two medically important lipoproteins are low-density lipoproteins, LDLs, and high-density lipoproteins, HDLs. High-density lipoproteins are sometimes called good cholesterol because it absorbs cholesterol and carries it back to the liver. The liver then flushes it from the body. High levels of HDL can lower your risk of heart disease and stroke. Low-density lipoproteins are sometimes called bad cholesterol because high blood levels of these lipoproteins are associated with increased risk of cardiovascular health problems. Exercise tends to increase high-density cholesterol concentration, while smoking has the opposite effects on the LDL and HDL ratio. Now let's take a look at erythrocytes, often called red blood cells. We drew erythrocytes together during our first introductory lecture. Here is the drawing. Erythrocyte is a round biconcave cell. Erythrocytes are mainly involved in delivering oxygen to the tissue in the body. Also, erythrocytes transport carbon dioxide to the lungs for exhalation. When we breathe through the lungs, the oxygen gets attached to the hemoglobin. Erythrocytes transport oxygen throughout the body. They release it to all our cells and tissues. When hemoglobin molecules are emptied, they attract carbon dioxide and other waste gases, which they take back to the lungs to be exhaled. The biconcave shape gives a cell a much greater ratio of space area to volume, which enables oxygen and carbon dioxide to diffuse quickly to and from the hemoglobin. Your healthcare provider can check on size, shape, and health of your erythrocytes using blood tests. An average lifespan of a red blood cell or erythrocyte is 120 days. This is because mature erythrocytes do not have nucleus. This does not mean that they are prokaryotic cells. Initially, when they were younger and immature, they had the nucleus, but they dumped it out from the cell since they have to conserve space for hemoglobin molecules. Remember, in the beginning of the lecture, I said that erythrocytes function as containers for red pigments, or as we call it, hemoglobin molecules. Hemoglobin is an essential for transferring oxygen in your body from the lungs to the tissues. As you remember, nucleus of a cell contains an informational molecule called DNA. The molecule has all the information concerning making proteins. Without DNA instructions, a cell cannot repair itself. Therefore, when erythrocytes dumps out the nucleus, it loses its ability to carry on mechanism of a cell repair. Therefore, the lifespan of the erythrocytes is only 120 days. And therefore, erythrocytes have to be constantly made in the human body and poured into the blood circulation, similar to what you see on the Edward Munch painting, where the waterfall replenishes the heart-shaped pond. An adult typically produces 400 billion platelets and 200 billion erythrocytes and 10 billion white blood cells, or leukocytes, every day. Like leukocytes, the erythrocytes are produced in the red bone marrow during process of hematopoiesis. The word hematopoiesis is from Greek meaning to make new blood. It refers to the formation of blood cells. Hema means blood, and poiesis means to make. In children, hematopoiesis takes place in long bones, like in femur. As you can see from this slide, long bones contain yellow bone marrow and red bone marrow. The blood cells made in the red bone marrow. Yes, red bone marrow is where erythrocytes, leukocytes, and megakaryocytes are created. The function of yellow bone marrow is to store fat and produce erythrocytes during life-threatening situations. During serious emergencies, our body can experience rapid blood loss. Yellow bone marrow essentially transforms into a red bone marrow during life-threatening events to produce blood cells and keep us alive. It also aids to a production of fat, bone, and cartilage. Importantly, it helps with the storage of fat cells known as adipocytes, which helps provide sustenance for bones to function. Bone marrow stays red until the age of 7. As we age, about half of the red bone marrow is slowly replaced by yellow bone marrow. Adults have an average of 5.7 pounds of red bone marrow. In adults, hematopoiesis mostly occurs in vertebra, hips, ribs, skull, and breastbone. As you hopefully remember, we call this part of the skeletal and axial skeleton. So most of our blood is produced in the axial skeleton. In some cases, doctors need to place a biopsy order for their patients. A biopsy is a sample of tissue taken from the body in order to examine it for the presence, cause, or extent of disease. Usually bone marrow biopsy taken at the back of the hip, known as iliac crest. When erythrocytes age, some rupture, spilling their hemoglobin into the blood. The worn-out erythrocytes are removed by cells called macrophages. Macrophage. Macro means big. Phage means eater. Macrophages located primarily within the bone marrow, liver, and spleen. As you remember from lecture 20, the spleen is the largest organ of lymphatic system that acts as a filter for blood as part of the immune system. The hemoglobin released during this disruptive process is changed in the liver to bilirubin, which is subsequently excreted into a small intestines as part of the bile. Bile is a fluid produced by the liver of most vertebrates that aids the digestion of lipids in the small intestine. When you mix your digested food with yellowish-green bile and yellow-colored bilirubin, the result is brown. So now you know why your feces are brown. Remember, bilirubin is removed from the body by the liver. Should the bilirubin fail to be removed, it builds up in the blood, producing jaundice. Hepatitis can interfere with bilirubin excretion so that the waste builds up in the blood, turning the skin and the whites of the eyes yellowish. Conditions that can cause jaundice include infections of the liver from a virus, hepatitis A, hepatitis B, hepatitis C, hepatitis D, and hepatitis E, or a parasite. Another reason is use of the certain drugs, such as an overdose of acetaminophen, or reactions to other medications, or exposure to poisons. For example, poisonous mushrooms. Cirrhosis is usually a result of liver damage from conditions such as hepatitis B or C, or alcohol use. The damage done by cirrhosis typically cannot be undone, but if caught early enough and depending on the case, there is a chance of slowing it with treatment. A chronic infection by the hepatitis C virus is the most common cause of non-alcoholic cirrhosis in the United States. In most cases, it takes many years for the infection to lead to scarring. Still, only 20% of people with chronic hepatitis C ever develop cirrhosis. Many people don't seek treatment for chronic hepatitis C infection because they do not know they have the virus. For many years, there are no symptoms that indicate infection. It is only years later, when the hepatitis C leads to a serious health issues, that many people seek medical attention. This is why hepatitis C is known as silent killer. For many years, there was no medication for this infection, but recently, most people can be cured of hepatitis C virus. Yellow fever is a hemorrhagic condition that can lead to a high fever, bleeding into the skin, and cell death in the liver and kidneys. If enough liver cells die, liver damage occurs, leading to jaundice, a condition in which the skin takes on yellowish color. In tropical and subtropical areas of Africa and South America, the virus is spread to people by the bite of an infected female mosquito, Aedes aegypti. It is very rare cause of illness in the United States. Illness ranges from fever with aches and pains to severe liver disease with bleeding and jaundice. There is vaccine that can stop you getting yellow fever if you are traveling to an area where the infection is found. So if you have to go to visit one of these countries, a couple of months before, please tell your doctor, and doctor will arrange the vaccination for you. I will post lectures on infectious diseases where I will discuss this in more details. But now let's see what else can go wrong with the red blood cells. Besides damages to the organs that recycle them, there are other things that can go really wrong. Anemia is a condition in which one lacks enough healthy erythrocytes to carry adequate oxygen to the body's tissue. Having anemia, also referred to as low hemoglobin, can make one feel tired and weak. There are many forms of anemia, each with its own cause. Anemia can be temporarily or long-term and can range from mild to severe. In most cases, anemia has more than one cause. See your doctor if you suspect that you have anemia. It can be warning sign of a serious illness. Let's take a look at drawings of different kinds of blood smears under the microscope. Here is the normal one. Your blood oxygen level is measured as a percentage. 95 to 100% is considered normal. If there are less oxygen, the condition is called anemia. There are more than 400 types of anemia, and they're divided into 3 groups. Anemia caused by blood loss, anemia caused by decrease of faulty erythrocyte production, anemia caused by destruction of red blood cells. Let's take a look at another blood smear. Here's one. Here's another. And the third one. On the first drawing of a blood smear, you see less blood cells. This reason could be that by some reason Our body produces fewer erythrocytes than usual, or body destroys erythrocytes faster than it can produce, or simply one has blood loss as a result of hemorrhage, either external, and you would know it is right away, or internal. What can indicate internal hemorrhage is presence of black stool. If your feces are black and tarry, it could be a very dangerous condition. It is a sign of a medical problem that you don't want you to ignore. A bleeding ulcer is the most common concerning cause of dark stools. An ulcer is an open sore on the inside of your stomach or small intestine. However, eating black licorice, blueberries, blood sausage, or taking iron pills, activated charcoal, or medications that contain bismuth, such as Pepto-Bismol, can also cause black stools. So in these cases, one should not worry. Even if you think you know why it is happened, always call your doctor if you have black tarry stools. On the second drawing of blood smear, erythrocytes looks like a sickle, which is a C-shaped farm tool. Sickle cell disease is a common inherited blood disorder in the United States, affecting an estimated 70,000 to 100,000 Americans. Inherited blood disorder means it is passed down through families. One is born with a sickle cell disease. It is not something you catch or develop later in life. It is inherited when a child receives two genes, one from each parent, that code for abnormal hemoglobin. So in order to have the disease, both parents will have to be carriers of a gene for it. The sickle cells die earlier, which causes a constant shortage of erythrocytes. Also, when they travel through small blood vessels, they get stuck and clog the blood flow. This can cause pain and other serious complications, such as an infection, acute chest syndrome, or even stroke. There are several types of sickle cell disease. The specific type of sickle cell a person has depends on genes they inherited from their parents. The only therapy approved by FDA that may be able to cure sickle cell disease is a bone marrow or stem cell transplant. Bone marrow or stem cell transplants are very risky and can have serious side effects, including death. For the transplant to work, the bone marrow must be close match. Usually, best donor is a brother or sister. In the United States, 90% of people with sickle cell disease are African Americans. Sickle cell disease also affects some people who come from Hispanic, Southern European, Middle Eastern, or Asian Indian backgrounds. Over 300,000 babies with severe sickle cell disease are born each year in this world. You probably noticed that all these groups of people are having ancestors that came from an areas where the infectious disease called malaria is common. One of the biggest killers in the world, malaria parasites, invade and destroy erythrocytes. For many people, and particularly children, malaria infection is deadly. Having sickle cell trait helps to protect a person from harmful effects of malaria, even though it introduces other health problems in the process. This is because abnormal hemoglobin molecules are detrimental to the malaria parasites. A person with only one gene for sickle cell has no symptoms of the sickle cell disease and has a good chance to survive if infected with malaria parasites. This is because the person able to produce some abnormal hemoglobin molecules that inhibit the parasite from multiplying. Moreover, the person has more chances to live offsprings than a person who has only normal hemoglobin molecules in the affected by malaria areas. However, a person with two genes for a sickle cell mutation suffers the resulting disease, though not affected by malaria parasite infections, and live long enough to live more offsprings. Though the lifespan gets shortened, they do not die in childhood and live chance to pass and have chance to pass their genes to other generations. Look here to see what parasites do to the people without sickle cell anemia. But in sickle cells, hemoglobin molecules are not the same. They are different and detrimental to the malaria parasites. Malaria is the most commonly transmitted by an infected female mosquito. The mosquito bite introduces parasites from the mosquito's saliva into a person's blood. Infected with malaria parasite erythrocytes eventually rupture because parasites multiplied inside them, and all the little babies of malaria parasites are coming out and start infecting another erythrocytes. In this slide, the Plasmodium babies are yellow. In reality, they're all transparent. The name of the malaria parasite is Plasmodium. Plasmodium is unicellular eukaryotic parasite. It is not a bacteria, is not a virus, but unicellular eukaryotic parasite. Plasmodium is the name of the parasite genus, which contain many species. The deadliest one is Plasmodium falciparum. Plasmodium means plasma-like, falciparum, falsi, curvy, parum, to give birth to. So what does it mean to all together? You see, sexual form or sex cells of Plasmodium falciparum, not other species, are curvy, or other words, banana shape. This is why species called falciparum, Plasmodium falciparum. Plasmodium falciparum is responsible for around 50 of all malaria cases. It is the deadliest parasite that claims many more lives than any other species. Plasmodium falciparum is therefore regarded as the deadliest parasite in humans. It is also associated with the development of blood cancer, Burkitt's lymphoma, and is classified as probable carcinogen. Now you understand why mutation for trait of sickle cell anemia were beneficial at one time, but it is of course disadvantages in nowadays. Now let's take a look at the smear number 3. The condition is known as microcystic anemia and iron deficiency anemia. The erythrocytes don't have enough hemoglobin. It is characterized by small pale erythrocytes. Iron deficiency anemia is usually caused by blood loss without sufficiently compensatory iron ingestion. This also may be due to decreased iron in the diet, poor absorption of iron from the gut, acute and chronic blood loss, increased demand for iron in certain situations like pregnancy or recovering from major trauma or surgery. This also can be caused by deficiency of vitamin B12. This vitamin is needed to make erythrocytes, which carry oxygen to all parts of the body. B12 is so abundant in meat that deficiency is rare, except in strict vegetarians. It also can occur when glands of the stomach fail to produce substance called intrinsic factor that the small intestines needs to absorb vitamin B12. This is more common in old age because of atrophy of the stomach. It also can be hereditary. It is treatable with vitamin B12 injections. Oral B12 would be useless because the digestive tract cannot absorb it without intrinsic factor. What you see in front of you are 3 centrifuge blood samples in the test tubes. Can you tell which of them are normal and which of them look unusual to your eyes? You are correct if you say that test tube number 1 is normal. As you remember from the beginning of the lecture, erythrocytes make up 44% of the blood. 1% are leukocytes and thrombocytes. 55% is plasma. But what about test tube number 2? I believe you recognize the case of anemia. There are much less erythrocytes in test tube number 2 than in test tube number 1. Polycythemia vera is a type of blood cancer. It causes one's bone marrow to make too many erythrocytes. This excess cells thickens person's blood, slowing its flow, which may cause serious problems such as blood clots. Polycythemia vera. Poly means many, cyte means cell, heme, blood, vera means true. Polycythemia vera. On this we finish with erythrocytes or red blood cells. And now let's begin to talk about leukocytes, also known as white blood cells. As you already know, leukocytes are part of your immune system that protect your body from infection. These cells circulate throughout your bloodstream and tissue to respond to injury or illness by attacking any unknown organisms that enter your body. Contrary to their names, leukocytes or white blood cells are colorless, but can appear as very light purple to pink color when colored with dye and examined under a microscope. These cells have a round shape with distinct nucleus. There are 5 types of leukocytes. Let's put them in order from most abundant to least abundant. What can help us to do so is a little memory device. Never let monkey eat bananas. Never stands for neutrophils. Let stands for lymphocytes. Monkey stands for monocytes. It stands for eosinophils. And banana stands for basophils. Neutrophils outnumber the other leukocytes, making up 60% of the leukocytes in the blood. Neutrophils are about twice as large as erythrocytes. Neutrophil nuclei consist of 3 to 6 lobes. Neutrophils are our body's bacteria and fungi slayers. They are active phagocytes. Phagocytes literally means cell eaters. They engulf bacteria and fungi and then kill them by producing bleach, hydrogen peroxide, and defensins. Defensins are antibacterial proteins. The defensins form spears that pierce holes in the membranes of organisms phagocytes ingest. Lymphocytes account for up to 30% of leukocytes. Each of them has a large nucleus. T lymphocytes, also known as T cells, function in the immune response by acting directly against virus-infected cells and tumor cells. B lymphocytes, also known as B cells, give rise to plasma cells, which produce antibodies that are released to the blood to destroy disease-causing substances. Antibodies are proteins that are able to fight infection. They are produced in large amounts during an infection. Monocytes account for 3 to 8% of leukocytes. The nucleus of the monocyte either of U-shape or of kidney shape. They differentiate into highly mobile macrophages with prodigious appetites. They play a major role in protecting our body. These blood cells surround, attack, and destroy the unwanted invader. Besides killing bacteria, they activate lymphocytes to mount the immune response. Eosinophils are harder to find in a blood smear because they are only 2 to 4% of all leukocytes. Their role is to lead the counterattack against parasitic worms, tapeworms and flukes, pinworms and hookworms that are too large to be killed by neutrophils. They gather around the parasite and release enzymes onto the parasite surface, digesting it away. Eosinophils are abundant in mucous membranes of the respiratory, digestive, and low urinary tract. Eosinophils may also lessen the severity of allergies by inactivating certain inflammatory chemicals released during allergic reactions. They phagocytize and dispose of inflammatory chemicals, antigen-antibody complexes, and allergens, foreign antigens that trigger allergies. Basophils are the rarest of leukocytes. They account for only 0.5 to 1% of leukocytes. They are responsible for inflammatory reactions during immune response, as well as for the formation of acute and chronic allergic diseases. They also produce compounds that coordinate immune responses, including histamine, a chemical that mediates itching. It increases the permeability of the capillaries. Histamine induces inflammation. It also produces heparin that prevents blood clotting. Here, all the leukocytes now lined up in order from most abundant to least abundant. Scientists differentiate these 5 types of leukocytes into 2 separate groups. Take a close look at these cells and try to do the same. Is there any features you see that might be useful in this differentiation? What some of the leukocytes have that other leukocytes don't? Do you see granules or large inclusions that some of these cells have while others don't? Yes, Neutrophils, eosinophils, and basophils contain visible stain granules inside them, granules that are visible while stained with a special histological dyes. Because of this feature, this group of leukocytes called granulocytes. Granulocytes. Lymphocytes and monocytes are considered to be agranulocytes. A means without, so literally it means cells without granules. So 5 types of leukocytes are grouped into 2 categories known as granulocytes and agranulocytes, terms which simply describe their staining characteristics. Drawing is very important skill in biology. Drawing is merely making lines and dots on paper. If you can write your name, you can draw. Drawing in biology course is combining biological knowledge and observational skills. Therefore, in biology or human biology course, you must be able to produce good quality scientific diagrams regardless of your artistic ability. Drawings not only allow you to record a biological image, but they help you to remember this image as well as important features of it. I bet in your biology course you already were required to look at the number of specimens and make diagrams. And those that you completed correctly, you remember better than those that you didn't. Now we will diagram together each type of leukocytes. I believe all of you can draw a circle. Pay attention to the size of the circle since leukocytes have different diameters. Let's draw a thin strand of neutrophil nucleus and the lobes of the nucleus. Neutrophils nuclei consist of 3 to 6 lobes, as you remember. Neutrophils also contain granules. Now let's diagram lymphocyte. Each of the lymphocytes have a large nucleus. The nucleus of monocyte either of U shape or of kidney shape. Nucleus of an eosinophil resembles an old-fashioned telephone receiver or large headphones, 2 lobes connected by a broad band of nuclear material. Cytoplasm of eosinophils has an abundance of coarse rosy or orange-colored specific granules. Basophils also have large nuclei. Their nuclei either U or S-shaped, with 2 or 3 conspicuous constrictions. Basophils recognized mainly by an abundance of very coarse dark violet specific granules. The nucleus is largely hidden from the view by these granules, but we do not want to completely cover it on our diagram because we want to demonstrate the morphology of the nucleus. So I believe now it is clear that leukocytes, the cells of the immune system, they fight off infection and foreign materials. An infection occurs when germs enter the body, increase in number, and cause a reaction of the body. Now, question to you. What infectious disease do you know that destroys ability of human body to fight infections? It weakens the immune system and human body literally becomes eaten by various microorganisms, even those ones that are not pathogenic to humans with healthy immune response. Do you know the answer? Think for a moment. If you need time, pause the video now. The answer is AIDS, acquired immunodeficiency syndrome. AIDS is a chronic, potentially life-threatening condition caused by the human immunodeficiency virus, HIV. By damaging a human immune system, HIV interferes with one's ability to fight infection and disease. There is no cure for HIV infection for adults. Only for newborns, we have effective treatments that clear infection for good. AIDS is the last stage of HIV infection. I'm going to discuss this life-threatening infection in one of my lectures, but now let's take a look at thrombocytes. Thrombocytes are not really cells, but part of the cells that broke off from the surface of large white blood cells called megakaryocytes. Thrombocytes play important role in blood clotting to seal wounds. Once again, you heard an unfamiliar word, megakaryocyte. Megakaryocyte. Mega means large, karyo nucleus, cyte cell. Megakaryocyte is a gigantic cell visible to the naked eye with the huge multiple lobed nucleus and multiple sets of chromosomes. Most megakaryocytes live in the red bone marrow. About 25 to 40% of the platelets are stored in the spleen and released as needed. The remainder circulates freely in blood and live for about 10 days. Activated thrombocytes promote clot formation called thrombosis, inflammatory responses, and contribute to wound healing. In pain, thrombocyte activation can lead to uncontrolled bleeding. Pathological activation of platelets is characteristic of several diseases, such as atherosclerosis, stroke, high blood pressure, also known as hypertension, and deep vein thrombosis. But what is thrombosis? What is blood clot? Blood clot are gel-like clumps of blood. They are beneficial when they form in response to an injury or a cut because they plug the injured blood vessels, and this stops bleeding. Formation of blood clot called coagulation. However, too much clotting can cause problems. A blood clotting disorder makes one's blood form clot too easily. Blood clotting disorders can be dangerous, especially when one doesn't get treatment. People with coagulation disorders have an increased risk of getting blood clot in their arteries and veins. Blood clots in one's vein can travel through the bloodstream and cause deep vein thrombosis or pulmonary embolus. Perhaps you heard of a condition called hemophilia or bleeder's disease. This is when people after a cut continue bleeding for a long time because blood clot is not forming. Hemophilia is usually an inherited bleeding disorder in which the blood does not clot properly. When we cut ourselves, we usually take blood clotting for granted. We know it is going to stop sooner than later, but blood clotting is not such a simple process as one might think. Many things has to happen before this will occur. For blood to stop bleeding, the following steps should occur. First of all, the injured blood vessel should get smaller to get less blood through. Then platelets should rush to the site and stick together to form a platelet plug. The platelets do this through adhesion, activation, secretion, and aggregation. And the last step is very important. Clotting factor proteins in the blood should work together to make threads of fibrin. The fibrin weaves itself into a clot over the platelet plug. This makes a strong seal. The first two steps to stop bleeding usually work just fine in person with hemophilia. The blood vessels get smaller and the platelets make a plug. Some people think a person with hemophilia can bleed to death from a small cut. This is not true. The first two steps are usually able to stop bleeding from cuts and scrapes. A person with hemophilia has problems when a fibrin clot is needed to stop the bleeding. People with hemophilia don't have enough of certain clotting factors. Because of this, the fibrin clot is not made, or is it so thin that bleeding goes on. Someone with hemophilia does not bleed faster than someone without hemophilia. However, the person with hemophilia will bleed longer. Bleeding inside the body is more of a problem for people with hemophilia than bleeding on the outside from a cut or scrape. Inside the body, the blood can go into spaces in joints, muscles, and organs. This can cause great damage, especially if the bleeding is not treated or happen over and over. Many times the bleeding, especially bleeding in muscles and joints, is caused by an injury. The person with hemophilia might bump his knee or his elbow. However, for some people with hemophilia, the bleeding can start for no clear reason. For example, the person with hemophilia could just be walking and have a bleed start in his knee. This is called spontaneous bleed. Whether caused by injury or spontaneous bleeding must be treated as soon as possible. People with hemophilia usually do not say they are bleeding. They say they're having a bleed. You will hear them say, I had 4 bleeds last month, or it feels like I'm having a bleed in my ankle. Hemophilia is sometimes referred to as the royal disease because it's affected the royal families of England, Germany, Russia, and Spain in 19th and 20th century. Queen Victoria of England is believed to have been the carrier of hemophilia. She passed the trait on to 3 of her 9 children. Her son Leopold died of hemorrhage after he fell when he was 30. Her daughters Alice and Beatrice passed it on to several of their children. During his travel around the world, Tsar Nicholas of Russia married Alice's daughter despite protests from his side of the family because they knew about the hemophilia. There was no surprise when his son Alexei was born with hemophilia. Their family entanglement with Rasputin, the Russian mystic, and their deaths during the Bolshevik Revolution have been chronicled in several books and films. Hemophilia was carried through various royal family members for 3 generations after Victoria, then disappeared. For over a century, physicians have tried to counteract severe blood loss by transfusing blood from one person into another. Often their attempts were not successful and resulted in severe illness and even deaths for the recipient. Why did the first attempts at transfusing blood save some lives but not others? I will discuss in my next lecture on human blood types.